Good afternoon, everyone. My name is Maya Luria with TMC for Seniors. And today we are going to be starting with our survivorship series. We're going to be talking about diet and nutrition and the role of diet and nutrition in prevention, treatment, and survival. I have with me Mary Marian here. You may have seen Mary before. She has been with our program over the years doing different nutrition clinical things. And Mary is a doctor of clinical nutrition. She knows a lot about how cancer and nutrition sort of, the roles that they play together. So, Mary, welcome. How are you today?
I'm good. Thanks for that nice introduction.
Good. I'm so glad you're here. So, we do have an online audience that's watching along with an in person audience. So, if you're watching from home, please go ahead and if you've got questions, leave them in the chat and I'll address those to Mary after her presentation. I'm going to go ahead and put your presentation up so you can get started.
Great. Thank you. Well, welcome everybody. I'm glad to see everybody's interested in nutrition. And this is maybe a little general because we're talking about three big things: prevention, treatment, and survival. So Maya wouldn't give me the whole day to speak. So I crammed everything into 1 hour. So hopefully through questions at the end, you can get maybe some specifics answered that pertain to you without going into a lot of detail. Okay, so talking about cancer prevention, why do we talk about cancer prevention? Well, you can see on the lower right-hand side, your right-hand side, that a lot of people are affected with cancer. I don't know if everybody here has had a cancer history or journey, but most people know someone who has been diagnosed with cancer. In fact, it's been estimated 1 in 2 men will be diagnosed with cancer in their lifetime and 1 in 3 women in their lifetime. And we know that lifestyle can play a significant role in cancer development related to some of the cancers, definitely not all the cancers. And we may not have research on all the cancers because we know now that cancer, a specific type of cancer, can be a family. So like breast cancer, you have the umbrella of breast cancer, then you have ER positive, ER negative, inflammatory, and then there's trickles down to different subtypes, and the same is true with a number of other types of cancers. And then we know that a lot of people need treatment, and during treatment, people deteriorate for lots of reasons, and I'll address some of those because of the cancer treatment by itself. And if you're in better shape going into treatment, you just do better in general, which I think most people would think is a no-brainer. So why is cancer becoming so prevalent? I have a question for you guys. Do you think chronic diseases are related to inflammation? I know inflammation is like a buzzword today. And so obviously the answer is true because I saw everybody shaking their head yes. And so why is this? This is like probably more than you ever wanted to know about science and biology, but these are the mechanisms on the underlying foundation or possible causes of why cancer occurs. And it could be related to lifestyle, obviously genetics. It could be related to our environment, our exposure to different things. We all know that we're being bombarded constantly with stuff, right? Toxic stuff and other stuff. So when we talk about inflammation affects all these sectors. So the higher your inflammation level is, potentially the lower your antioxidant defenses are. What are you combating the inflammation with? And then it results in immune dysfunction, DNA damage. Apoptosis is a word that we use for cellular death. We know cells have a cell life and they just naturally die. But apoptosis can be delayed, and then the cell undergoes some abnormalities that can lead it more into becoming a cancer cell. And then detoxification. We know a lot of people today are walking around with fatty liver disease. And if your liver is full of fat, it's not going to work ideally as a detoxifying agent. So these are just some of the underlying reasons that are purporting to produce inflammation, and I'll show you another slide later down the road as well. So when we talk about food, what is the research related to what we eat and cancer prevention? And unfortunately, the word diet is always attached to anything that's nutrition related, right? Like you see on the slide here. And so we have this diet mentality instead of thinking about nutrition patterns, eating patterns. What do we eat in general, not what kind of diet that we're on. And unfortunately, in a medical setting, in a hospital setting, many times they drill down into protein and sodium and cholesterol and fat, right? They're telling us maybe things, what you're not supposed to do versus what are you doing and what can you do a little bit differently. So when I meet with people, I have a private practice, I take what are you currently doing, and then I just suggest recommendations on how to improve what you're already doing. I don't tell you that you can't do something. So these are diets that have been explored and investigated for various reasons that have shown to help with decreasing the risk for cancer. So has everybody heard of the Mediterranean style diet? Yeah. How about the DASH diet? Anybody familiar with the DASH diet? So it stands for Dietary Approaches to Stop Hypertension. And basically what it is, it's very high fruits and vegetables, higher protein, a little bit higher calcium intake, and higher magnesium and potassium intake, because all of those nutrients have been shown together to be helpful in decreasing blood pressure. Whether you do anything else or not, whether you exercise or whether you lose weight if you're overweight or obese, this diet by itself has been shown to be beneficial with blood pressure. And then everybody's heard of the vegetarian diet. Again, vegetarian is a big umbrella for what kind of vegetarian are you? Are you a vegan? Are you lacto-ovo? Are you vegetarian? So in my job, I have to drill down to explain to me a little bit more about what you are doing versus just throwing out words. So this is an example of what the Mediterranean diet basically recommends. There's a foundation of fruits and vegetables, nuts and seeds, some more plant-based. And a lot of people, when they hear that word plant-based, they're like, whoa, I'm not going to become a vegetarian. And that's not what this means. It means that your diet is primarily plant-based. So it can be grains, it can be fruits, it can be vegetables, like I said, nuts and seeds. And then you layer the protein on based on, let's say, maybe quality. So quality could be legumes, like beans would be next, and then maybe soy, which is also a bean. And then you layer on fish and chicken and red meats at the top, because red meat has more association with different types of cancers as well as processed meat. And then it's higher in fiber. It's normally higher in fiber just because if you're doing more whole grains and less processed foods, ultra processed foods, I should say, more fruits and vegetables that come with the fiber, people think about fiber in regards to bowel regularity, which is totally true. But it's also an antioxidant. It's something that helps our antioxidant defenses in our body, going back to that inflammation picture again. And then fiber also binds cholesterol levels. So it can help with reducing your risk for coronary heart disease. And then in conjunction with the weight picture, it helps fill us up longer. And so if you have a higher fiber diet, because it's legumes, fruits, and vegetables, you're more likely to be less likely to be looking for food like an hour later. And that's what some people have challenges with. And then you can see the last point there is it's low in sweets and sweetened beverages. So get rid of the soda kind of thing. But it doesn't say you can't have any sweets. And we'll talk about that. So then we kind of group things together, again, going back to inflammation. What are pro-inflammatory producers? So you can see on the left-hand side of the slide here, the typical American diet just provides lots of this. And that's probably why we have an issue with inflammation in this country. And that's why you've heard more about the anti-inflammatory diet. And again, that word diet is hooked on there. But just think of it in terms of it's more of a plant-based diet, it's more of a Mediterranean diet, or the DASH diet. So it doesn't have to be associated with unpalatable kinds of food. And I'll talk a little bit more about some of the other attributes as we go through the presentation. The big thing that this slide shows and the next slide is that less processed food in general, and then fruits and vegetables, nuts and seeds. They provide elements or healthful benefits in our diet that you don't find in protein, carbs, or fat. And they're called phytonutrients. And they're mostly found in plants. And that's probably why diets like the DASH diet and the Mediterranean diet and the different types of vegetarian or vegan diets are more helpful in our bodies in reducing or managing a lot of different types of diseases, because they produce or provide more antioxidants. And then here's a list of other things that they provide. So I'm just going to pull out anthocyanins, which is kind of in the middle of the column here. Anthocyanins are found in red and blue kinds of fruits and vegetables. And you can see here that they have antioxidant capabilities. And then if we go to, I'm just going to move to the next slide. I'm going to pick out again in the middle of the column, isothiocyanates. I know it sounds like it would be in a chemical drain cleaner, but it's found in the cruciferous veggies. So broccoli, cauliflower, cabbage, kale. I know everybody's part, if you're into nutrition at all, you've heard about the value of cruciferous veggies. And one of the reasons is because of the phytonutrients found specifically in those foods. So I named off those foods. They look totally different than the foods that have the anthocyanins in them, right? Said anthocyanins are red and blue, and you think about cabbage and kale and cauliflower, they're green and white, right? Different colors. That's why you hear the recommendation, eat like a rainbow, because all of these foods bring different nutrients to the table. And the more value, the more you have in the diet, just the more value that you get. And so that's something to think about as you're going through the day. Breakfast is a little more challenging for most people. A lot of breakfasts are white because people tend to have cereal, milk, toast, eggs. And so think about infusing some color in there, like having some berries or peaches. Right now, the peaches are pretty good. And then as you go through the day, just think about, oh, what have I been eating today? It's interesting when I do diet histories with people, the lack of color in their diet throughout the day. And it's something people don't think about. So when we talk about now, let's say you've been diagnosed with cancer and the doctor says, okay, well now the best intervention is treatment. And there's lots of different treatments, and we'll go over those in a second. But like I said, the better you shape that you're in going into whatever treatment or treatments you're going to need, the better you're going to tolerate it and the better the treatments are going to work. And obviously my big thing always is optimizing quality of life, trying to get you to do what you want to do throughout the day as much as possible. And we know during treatment that all the side effects on the right-hand side there, so nausea, mouth sores, diarrhea, constipation, taste changes, I'm going to throw fatigue in there, all of those kinds of things obviously do a number on us where we don't feel like we have a very good quality of life, right? And you feel really miserable. So if you can find ways to address that, and a lot of times when I meet with people and they talk about, well, I feel like I'm nauseated, but I don't ever throw up. And I'll ask them, well, have you been prescribed the anti-nausea pills? Yeah, but I don't like to take pills. I go, but it will help your quality of life to take them. And you're only taking them during this short period of time, and you're only taking them when you need them. But a lot of times we just resist taking things because we don't want to take pills or medications, when they can dramatically improve your quality of life, help you feel better, and help you feel like doing stuff as well as eating, if it's really interfering with your ability to eat. So then this is where the calories and the protein, and I would throw hydration in there. Because if you're losing weight during treatment, and some people are really happy about losing weight during treatment because they've always been trying to lose weight and now it's just coming off. Well, that's okay as long as it's slow and steady and you're meeting your protein needs, because a lot of the chemos have dexamethasone in the chemo if you're getting an infusion, which is a steroid. And steroid decreases protein synthesis, and it decreases muscle mass. So a lot of times studies have shown that people can maintain their weight while they're going through treatment, but there's an alteration in body composition where the body gains more fat and it has less muscle mass. So the bottom line, muscle mass wise, is that it leads to being deconditioned at the end of treatment. And obviously, the more treatments you have, the more you feel like you really need to build yourself back up afterwards. A lot of it is because you've lost muscle mass. Number two is that a lot of times people do not have a physical activity routine going into treatment. And then during treatment, they feel awful. But who feels like being physically active when you're nauseated and you're totally fatigued? But so many studies have shown if you do it, at least on the days that you feel good, then it really helps you tolerate treatment and you feel better. And it helps maintain your muscle mass. So there's like three things with the protein is that if you're not getting enough protein, because treatment in general increases your protein needs, and your body's going to steal it for calories because you're not getting in enough calories, and oh, by the way, you're on steroids, so we're going to take away more protein in general, then you're going to become really deconditioned by the time you finish the whole scheme of things. So trying to focus on consuming small, frequent meals is a big recommendation that I usually make. A lot of times people think that they need to stick to their usual routine of breakfast, lunch, and dinner. And they have this vision that, okay, here's what my normal plate size look like, or breakfast, my normal bowl size. And they feel like they need to accomplish that as they're going through treatment, when that definitely isn't one of our goals. The goal is just eating, getting those calories in by the end of the day, getting that protein in by the end of the day. So if you eat small, frequent amounts, like every 2 to 3 hours, and sometimes people are doing a great job on water, which is really important. Hydration is important, especially if you're on chemo. But water has no nutrition in it. There's no calories, there's no protein, there's no phytonutrients. So thinking about ways to convert that over to a more nutritious type of beverage. It could be milk, it could be a nutrition drink, it could be a smoothie, whatever. Sometimes I recommend easily just throw some unflavored protein powder in there so that you're drinking your water, but at least you're getting some benefit from the water. And there's a water that I just saw is advertised at Costco, and I can't remember the name of it, but it's a water with protein in it. So there's finally starting to be some products out there that might be super helpful. On the right-hand side there, you can see those are recommendations for what we recommend if you have these side effects. So nausea, you can see small, frequent meals. Mouth sores, avoiding tart foods and spicy foods, anything that's going to aggravate the sores in your mouth. There's something called Miracle Mouthwash that you can swish around in your mouth if you have a lot of mouth sores that can help. Patients have told me it's only good for a couple minutes, but it might be something to investigate too. With diarrhea, these are nutritious recommendations, but typically the brat diet is not something you want to stay on very long because it's just rice and like broth and applesauce, bananas, and that would get pretty old very soon, and there's very little protein in there. So usually with diarrhea, you're probably going to need something like Lamotil or Imodium, so over-the-counter products, and then soluble fiber really helps. So something like a product, I love Benefiber, only because I can throw it in my water here, and it's going to totally disappear. It doesn't change the flavor of the water. It doesn't get all gummy like some of the other products do, and it really helps with both diarrhea and constipation. So it's an easy-peasy thing to use. And I believe Costco has their own version of it. I can't remember the name of it, but it's a lot cheaper if you have a membership at Costco. And then constipation, same thing, is the Benefiber product or alternative product can be really helpful, as well as hydration for both of these, because you're losing water with diarrhea and you're not maybe getting enough water with the constipation. And a lot of the chemo agents and radiation to the abdominal area can promote both of these kinds of issues. And then taste changes. This is typically more with chemo, maybe radiation to the head and neck area, because that's destroying a lot of cells in the oral cavity. taste changes can be problematic because nothing tastes good. You don't feel like eating anything, but you got to do it. And maybe liquid sometimes is better because you can use a straw and then it bypasses the bad taste in your mouth. Brushing your teeth before you eat too can be really helpful. So these are treatment-specific recommendations, and you can see with chemotherapy and radiation, you need higher amount of calories, you need a higher amount of protein. So with the calories, I don't ever give people like a calorie goal. I don't know how many calories you actually need. So the barometer is if you're losing weight, you're not getting enough calories. And like I said, if it's a slow and steady reduction in calories and you're getting enough protein, then that's probably an acceptable thing. But some people are like 5 pounds, 5 pounds, 5 pounds, and then you just are getting way too low. And then you may not tolerate treatment. They may have to stop the treatment because you're not tolerating it or there's significant changes in your weight. Same with radiation, like if you need to have a mask made to keep you mobilized while they're doing the radiation, you lose too much weight, then they're going to have to redo the whole mask process over. So you don't want to have to go through that again. Surgery, we know people just do better when they're in better nutritional shape going into surgery. So if you know these things are coming up, it's important to think about focusing on it and trying to get in enough protein and enough food before you start your treatment. Typically with chemo, a lot of people will do really well on the day of chemo because of the steroids in the chemo. And then maybe into the next day, and then you have a couple bad days. Hopefully you don't have a whole week of bad days, but some people do. And so it's important to think about strategies. What am I going to do on those days that I feel really awful? And then it depends on why are you feeling awful? Is it fatigue? Is it nausea? Are you having terrible diarrhea? Things like that, so that you can be prepared to have things available and not wait until you go to the doctor's office, either in 2 weeks or 3 weeks. Think about having nutrition drinks or things in the freezer. Think about having support for meal prep, even just bringing food to you. And, looping in family and friends if that's a possibility. I get this question all the time, does sugar feed cancer? And I'm amazed at what actual healthcare providers tell people, because this is not true. This is a myth. And you can see myth number 1 on there. All cells, including cancer cells in the body, use glucose for energy. Eliminating sugar will starve the cancer. Well, a lot of people, all types of people that have various medical conditions die of malnutrition. And cancer patients, malnutrition is very common when people have a cancer that's just out of control and it's untreatable at that period of time. So taking away things that have sugar in them or carbohydrate is only going to promote the malnutrition from becoming worse. Does the cancer grow faster with sugar? You can see no. And then why do these myths persist? It's because a lot of times people need a PET scan, and people who've gotten a PET scan know they have to have an IV. The IV has glucose in it so that the tracer that they put in there will be picked up by the cancer cells and light up on the scan so they can see where the cancer is if there's any. And so this has been perpetuated online and in the community that, the cancer cells are gobbling up the glucose, and that just is not true. And so, again, we're going back to biology and what happens mechanistically in the body. So you guys can read through these things, but I have found this is I think, maybe you won't agree with me, that this is a good example of why taking sugar out of the diet doesn't work. So would everybody agree with me that eating like an apple or a pear is really a healthy thing to do? Does anybody think that's a food that's bad for us? No. So what happens? We eat our apple, we chew it up, it goes down in our stomach breaks it down a little bit more, then it goes down to our small intestine, it's broken down into a liquid, and it's absorbed. Guess what? Most of that apple and other foods are going to be absorbed as glucose because our cells use glucose for energy. Our cells can convert protein to glucose, and we can use fat as an energy source at all, but most all cells in our body use glucose. Now, what do you think about a Snickers bar? Is that healthy for us?
No.
Does anybody like a Snickers bar?
Yes.
So the same thing happens. Chew it up, goes down to the stomach, it gets ground down a little bit more, and when it gets to the small intestine, it's absorbed primarily as glucose. So the moral of the story is the glucose is floating around in the cells or floating around in the blood, comes to the cell, knocks on the door, has to have insulin to let it in. Do you think the cell can tell where that glucose came from?
No.
So how is it going to tell whether it's from sugar or whether it's from the apple, right? It can't. That's why this is pretty crazy. So I'm not advocating a high sugar diet, even though I like Snicker bars. But we want to put it in context of what are you doing in general. So the only nutrition organization that's come out with a sugar recommendation besides lowering your sugar intake, I have found that people like, what are specifics? Tell me exactly what is okay to do. So the American Heart Association says that women can have 6 teaspoons of sugar a day. So that's 24 grams of sugar, added sugar. We don't count sugar in fruit or dairy products because it's part of the natural product. It's not anything we added, like our little Snickers bar. And then men get to have 36 grams, so they get a little bit more because they have more muscle mass and they have to maintain that muscle mass. So if you put it together with a healthy backbone of what you're eating, the sugar isn't inconsequential as far as being detrimental. Now, should you have a big, huge bowl of ice cream every night with chocolate sauce on it? Probably not. But if you have it a couple times a week, I've seen so many people that just come to me and go, "Oh, I'm just dying for a little tiny ice cream. Is that going to make my cancer grow?" And so many people have taken this, I can't have any sugar whatsoever, and taken it to heart and really are not having a good quality of life. Oh, one other thing I did want to say is that number 2 here is that insulin resistance has been shown to potentially play more of a role in cancer development. And why is that at this point in time? I don't think we really understand that mechanism, other than that higher insulin levels are generally a little toxic to our body. So that's why we want this tight control. You eat, the pancreas generates insulin, the insulin works with the glucose, and then as everything is metabolized, all the levels drop to appropriate areas. Where with insulin resistance, you tend to have a higher level of insulin floating around. So you might have prediabetes, it might have type 2 diabetes, if you have type 1 diabetes, that your insulin isn't working ideally, then you could have insulin resistance. Okay, so let's talk a little bit about survivorship. Survivor goals are to address anything that you want to accomplish. So what do you want to do now? Do you want to improve your quality of life? Do you want to regain weight? Do you want to lose weight? Do you want to exercise more? Any of those kinds of things. So when I meet with people, I always go, okay, this is your session. What do you want to gain out of this session? So when we talk about, obviously, cancer, people want to either manage their cancer because it's not going away, or it's not going to go away, or you don't want it to ever come back. So when we think, going back to my discussion on cancer prevention, obviously we would apply those recommendations. And the recommendations for the med diet, as far as trying to get more fiber, fruits, vegetables, etc., those are applicable to treatment. So that's the dietary pattern that is usually recommended. And then obviously we troubleshoot those problems that I talked about as much as possible with other kind of things. Prevent secondary cancers. So we know that some of the hormonal related cancers like colon cancer and ovarian cancer and breast cancer, they tend to be interrelated. So if someone has one of those cancers, and let's say you're a woman and you've had colon cancer, then you want to obviously be thinking about the other 2 types of cancers. Treatment, address any treatment related problems. So sometimes people have GI problems. The chemo, nobody knows how long it takes the chemo to get out of our system if you've had chemo. Everybody's different. So I've heard 3 months, 6 months, I've heard a year. I've looked in the literature. I can't find a definitive answer. So the bottom line is it matters how long you're having these symptoms and just trying to work on them until they're either no longer symptoms or maybe they never go away. Especially some GI issues with radiation to the abdominal area because you're radiating the bowel, because our bowel sits right in here. And you think about, okay, our bowel is like 20, 25 feet long and it's crammed into here, right? So there's a lot of overlapping. And when you get radiation, even though it's like localized, it also affects bigger area than just where the cancer might be. So unfortunately, some people's bowel doesn't come back after it's been damaged by the radiation. And so you may have problems with maybe irritable bowel syndrome, diarrhea, or constipation, and you just have to kind of experiment with different things and see what works over time to deal with those issues. And then obviously we want to promote overall health and longevity, and I'm going to talk a little bit about weight. So when we talk about dietary patterns, again, this just really mirrors the Mediterranean style diet. And so basically good goals for people every day are trying to, at least to get the phytonutrients and the antioxidants and the fiber, try to at least get 2 servings of fruit, 3 servings of veggies. And if you have to flip those around, that's okay. Because I've seen some people who just aren't into either one of those things. And if you're not a fruit and vegetable person, then it's a little challenging to get the necessary benefits that are provided by the fruits and vegetables. So you might have to think about, well, how can I do that? A lot of times for lunch, I'll make myself a smoothie. And so I cram my 2 servings of fruit into my smoothie, and I'll grab a big, huge hand of spinach and throw it in there, or arugula, or whatever's in the fridge and dying, and I gotta get rid of it, right? And then I build it up with some protein powder. I know I have to have some fat in there because otherwise that smoothie is not going to last past an hour. And then I'm always focused on calcium and vitamin D, so I'll throw my milk in there. And if you're not a milk person, you could use like almond milk or one of the other nut milks. Just beware they're really low in protein. So I use mine as a protein source on top of my protein powder, but you can just easily use protein powder and use the nut milk in there, or lactose-free milk. That's not going to change the flavor of it at all. The National Institute for Cancer Research has recommendations about meat. And when we talk about meat, well, I'll come back to that because I have a better slide to talk about that. But so when we talk about protein, think about the hierarchy of it being beans first, if you can handle those, then egg whites and fish and chicken. Soy would be down here in the beans. And a lot of people, a lot of women ask me, well, isn't soy bad for breast cancer? And I've been in the business long enough that I've seen the pendulum go like this, and now it's back to where soy is fine. It doesn't seem to be affiliated with any negative issues whatsoever. Okay, so if you are overweight or obese, do you think losing weight will change your inflammation picture in your body?
Yes.
Yes, because I like this slide because it really illustrates physically what's going on. So over here on your left-hand side is our fat cells. And you can see that they're kind of nice and clear. And our normal fat cells, we used to think they just sat there and took up space. Well, we know today they don't. They're very metabolic organs where they're putting off all kinds of things, like we call them cytokines. There's anti-inflammatory cytokines and there's pro-inflammatory cytokines. They're putting off estrogens, androgens, and that's why some of the treatments for breast and prostate cancer target estrogen and androgen production, and they're targeting the fat cells in addition to other organs in the body. as we go to the middle slide here, you can see the fat cells are getting a little bigger. And then you see those little black things in there that look like little black spiders. Those are something called macrophages. Macrophages are part of our immune system. And what happens is they start infiltrating the fat, because when the fat cells get bigger and they're packed in there like sardines, they start dying because they can't get nutrition, they're not getting oxygen, and so consequently they start dying. Well, the macrophages have to come in and clean them up, because you can't just let dying cells sit around. So that's termed immune dysregulation, when the macrophages have to move into the fat cells. The other thing that happens is there's alterations in estrogen and androgen. The production goes up because now you have more fat cells and you have bigger fat cells, so they produce more. They produce more cytokines, not the anti-inflammatory, but the pro-inflammatory ones. And they also produce two things called leptin and adiponectin. You guys probably heard of leptin because it controls appetite for most people. But the more leptin we have, the more of a pro-oxidant impact it has on our body. And then the adiponectin level, one's the yin and one's the yang. So leptin's going up, adiponectin, the antioxidant, is going down. So then we get this imbalance in our body that's promoting more pro-inflammation and less anti-inflammation. And then the more fat cells that you have, then you can see that it continues this pattern of decreased anti-inflammatory, increased pro. Then you end up with insulin insensitivity issues, blood pressure issues, all that. And so that's why they focus, all the recommendations say, maintain a healthy weight. How do you know what a healthy weight is? Well, a healthy weight is a weight that you feel good at and your metabolic parameters look good. So like your cholesterol, your blood pressure, your glucose level, you could have a CRP level checked, which is a measure or reflection of inflammation in our bodies. It should be close to 1, and the higher it is, obviously, is a reflection of more inflammation that we have. So these are the cancers that are associated with more body fat in our body. And then when I talked about the American Institute for Cancer Research, they used to be really great about updating this on a regular basis, as well as one nice thing about them is if you go to their website, and it's just AICR.org, you go to their website and they have a tab that you can open related to different cancers. So it has a lot of lifestyle recommendations associated with risk and benefits for, I'd say, most of the cancers. I don't think every single cancer is on there. Like, I don't know if all the leukemias are on there, because diet doesn't really have a huge role in leukemia, except for during treatment. The same recommendations that I said would apply to that population. But they really did a nice job on, okay, well, what do we know decreases the risk for estrogen-positive breast cancer or colon cancer or pancreatic cancer? So it's a really nice site to check out. But this is a summary of their recommendations in addition to the American Cancer Society and National Cancer Institute. So I put them all together. But the big thing that AICR has I'm going to say stipulated is this recommendation about the red meat and the processed meat, because other organizations just say decrease your meat intake. And they come out and say, okay, 18 ounces of red meat a week is a good threshold, 18 ounces or less. And that's primarily related to our colon cancer risk. And so the way meat is digested in the GI tract, there's two components potentially that can increase our risk of colon cancer. So there's nitrosamines, and then there's the iron that's released from the red meat that they think is maybe what the detrimental piece is. And then we know about processed foods and processed meats. And I'd have to say this is a gray area or controversial area in the nutrition field about what if I buy lunch meat that doesn't have any nitrates or the other stuff in them? Well, it's still processed, and it's still different than the way it came off the animals. So some people like, oh yeah, that's okay. Other people are like, no, it's still processed meat. I do not have an opinion on that. I just tell people, just try to limit things that supposedly are not the healthiest for us as much as possible. Because sometimes you're going to be stuck somewhere, and Subway may be the only place for food. Now Subway has other options, but what I'm trying to say is don't feel guilty if sometimes you're dying for a ham and cheese sandwich. And then I'll go over the other things in just a sec. Another thing that's happened in our population today is things like Starbucks, where people go and get a beverage. All kinds of beverages are available today. I can't keep up with all the beverages today. And so some people don't realize that beverages can have as many calories and as much fat in them as like a piece of pizza. And so a lot of times people go, well, I'm really craving a piece of pizza. And I go, there's nothing wrong with a piece of pizza. I would love to have a piece of pizza at least once a week. It's just, do you have anything to go with your pizza? Do you have a salad, or do you have coleslaw, or something that your meal just isn't pizza? Because pizza does have some nutrition in it, but you're missing some things as well. So think about just more variety at mealtime than just maybe having your Starbucks latte, and this is only a grande. It's not the big venti guy. So alcohol, I know that this has become a hot topic since like January when it first started coming out in the news, which this was not any surprise to me. I already knew all this, but it takes the media to throw things out there for people to all of a sudden become aware. And so you can see that it seems like a small percent risk for cancer related to alcohol. But when you look at the experts, what they say, okay, well, what's a safe amount to have? You can see that the slide says there's no safe amount that we know is safe, except for none. So it's more affiliated with these types of cancers than other cancers, but I'd have to say that not all cancers have been studied for their impact of alcohol. And everybody probably knows the best study is one where you have a control group and you have an intervention group, right? And we just don't have a lot of that data related to nutrition and different medical conditions. And so a lot of it is extrapolated from huge cohort studies, like, have you heard of the Nurses' Health Study or the Health Physician Studies? They've been going on since the 70s. And there's thousands of people in both of those, what we call cohorts or groups. And so they monitor them, I think it's still yearly, and they look at lifestyle and, a whole host of other things. And then they correlate it with risk of heart disease, or did you get heart disease, cancer, things like that. And then they boil it down and go, okay, well, these people that seem to get postmenopausal breast cancer or prostate cancer or colon cancer, they tend to eat more of these kinds of things or drink more of these kinds of weight. That's where a lot of our nutrition research comes from. And with the research world right now, I don't know whether people are going to pour money into more randomized controlled trials. Hopefully, especially since at the beginning we talked about how many people are affected by cancer. We need this data to help us all practice cancer prevention and management. So on the right-hand side here, cancer survivors, you can see that it is highly recommended for breast cancer survivors, especially estrogen receptor positive, because alcohol increases estrogen levels. So that's something, would it affect ER negative? I don't think we have super strong data on that. I'm not advocating that it's okay to do it, but basically we know more about ER positive breast cancer because there's more women diagnosed with that. During treatment, it's recommended don't drink alcohol. Most people say they don't even have a taste for it. Think about mocktails. There's a lot of non-alcoholic drinks out on the market today if people really miss their alcohol. I just want to spend a couple minutes on supplements because I get this question all the time, should I take a supplement? And it probably depends on what you're eating, because Sometimes people take a slew of supplements and forget that food is also providing vitamins, minerals, other things on top of their supplements that they're taking. One that I would highly recommend, though, is vitamin D. And have you guys heard about the value of vitamin D? Anybody taking a vitamin D supplement? Good. Okay. So the big thing with vitamin D is that it can provide a host of benefits. It might help with decreasing risk for dementia. It's an antioxidant. Related to cancer, there are some studies that show that higher vitamin D levels can decrease the risk of colon cancer. It's been associated with not curing the cancer, but prolonging survival in colon cancer and lung cancer. We can't get enough in our diet unless you're drinking like 4 glasses of milk of vitamin D fortified milk every day. Salmon's the other big area that we get it, but unless you're eating salmon pretty consistently, it's difficult to get. Our fat cells sequester vitamin D, especially if we're carrying more in our midsection. So individuals who have more adiposity here usually need higher amounts of vitamin D to get a normal level. We need it for absorbing calcium in our GI tract and in southern Arizona, especially this time of year when we're more likely to synthesize vitamin D compared to winter. Are you outside in the sun? No. If you're outside in the sun, you might have sunscreen on or sun protective clothing. So we're not synthesizing vitamin D when it's at the highest point in the year that we can do that. So first of all, you should get your level checked to even see where you are. And most people need to be taking a vitamin D supplement. Most women, if you're not having calcium at breakfast, lunch, and dinner, you probably need to be taking a calcium supplement. And you can combine the two together. Omega-3s, we live in the desert. I don't know how many people eat fish on a regular basis here. Fish is a good source of omega-3s, with salmon and trout being at the highest, and then it kind of trickles down from there. But omega-3s also provide anti-inflammatory effects. The evidence is kind of more gray about probiotics. What you find in my field is that you have to know, why does somebody want to take a probiotic, to know whether there's any literature or research to support its use. So like in IBS, irritable bowel syndrome, some probiotics in specific types have been found to be helpful, whereas in other situations, probiotics can really mess things up. And you have to be careful about probiotics when you're on chemotherapy. B12, so you can see if you're on a plant-based diet or you're vegan, but also you have to think about B12 and you're at an increased risk for deficiency if you're on metformin or you're on the PPIs like Nexium, Omeprazole, even Pepcid. Those decrease absorption of B12, and they also decrease gastric acid, which we need to pull the B12 from whatever food we're eating it in. So people that are on those medications should probably be taking a B12. You could take B12, you could take a B complex, or you could just take a regular multivitamin. And there's a lot of multis now that, like the one I take, I think it has 2,000 IUs of vitamin D in it. So I can kill a lot of birds with one stone. Folate is a vitamin. It's a B vitamin that certain chemos like methotrexate and molybdenum can decrease its absorption. So again, we have to look at what kind of treatment you're on and will it affect any of the micronutrients. A lot of the doctors, I find, just automatically say don't take any supplements when you're on treatment, especially chemotherapy. Personally, I know the literature. You can take a multivitamin. It doesn't hurt you. Eating foods high in antioxidants are not going to hurt you. But whatever the doctor tells you, I say, do whatever they want you to do. And then you have to be careful about herb-drug interactions. So the more medications people are on, you have to be really careful on how herbal supplements, so like ginseng and turmeric, milk thistle, there's a whole slew of supplements out there now that can interfere with whatever medications people are on. So you just want to make sure that somebody's checking, is it okay for me to do this while I'm taking these medications? And mega doses of anything usually don't do anything. Okay, let's talk a little bit about physical activity because we're coming down the home stretch here. So physical activity is part of the paradigm as far as helping with cancer prevention, getting you through treatment, and then survival. And so what are the benefits of physical activity? Obviously, it can help maintain your muscle mass. It can help with weight control. If you're fatigued during cancer treatment, it can help reduce the fatigue. And I know it's a double-edged sword. Too tired to exercise. I have a lot of days like that. And then I make myself go do something and I feel so much better afterwards. Anybody have that experience? Yeah, you just got to make yourself do it. And how do you do that? So pick something that you like. I know people aren't physically active in general. They don't even want to think about the concept of doing it. So think about doing something you like. Think about making it easy. And think about if you're too tired, just breaking it up. So if you did like 10, 10, and 10, or 10 and 10, and I see a lot of people that have equipment in their house and it's in the other room, try to motivate yourself to just go get on your bike for 10 minutes. And most people say, okay, after the first 5-10 minutes, I feel so much better and I can keep doing what I'm doing. If you feel unsteady doing it by yourself, get somebody to go with you or start out slow in the house. There's so many things on YouTube nowadays that you could do chair aerobics, you could do chair yoga, you could use the wall for weight resistance, just doing some push-ups on the wall. There's so many things that can make it easier. And these are the benefits: decrease inflammation, enhance your immune system, regulate hormones, etc. Here's the benefits if you want to look at numbers. So you can see that it can reduce mortality. 40% is pretty, I think it's pretty amazing. 13% average reduction in cancer risk with just regular physical activity. And more research is coming out to show those numbers on the upper right-hand side, decreasing the recurrence of breast cancer or colon cancer. So, and the last couple of studies I've seen said, if we had a medication that could do this, people would do it. And we do not have a medication that is this beneficial for you as far as numbers and percent reduction. Benefits during treatment: it can help with side effects. I've talked about fatigue, I've talked about nausea, can help with sleep, it can just help you feel better. And then we talked a lot about muscle mass, cognitive function, and then get you through the treatment, because obviously that's a goal. If you need treatment and this is what the pattern is or the plan, you want to stick to the plan as much as possible. And then as far as survivorship, again, reduce recurrence. And then you got to think about, okay, my cancer's gone. I definitely don't want my cancer to come back, but you have to think about these other components. More people still die of heart disease. The steroids in chemo, or I know some people take steroid pills before the day of chemo and then the day after chemo. Steroids also have a detrimental impact on bone density. And so if you haven't ever had a DEXA scan to know what your bone quality looks like, you don't know if you have bone loss already. And then you're on a drug that can facilitate bone loss. And women who have ER positive breast cancer are on hormone blockers for 5 to 10 years, and that they also decrease bone density. And then obviously mental health. We just feel better. Okay, so what are our goals that we want to accomplish? The benchmark on all the health societies is 150 minutes a week of both aerobic and weight resistance training. And so basically, if you can weave those two things together, it just seems easier to do. So if you're a gym person, you can go to the gym, and it's best to do your weights first, then add on whatever else you're going to do, like the treadmill or the bike or whatever. Or you can just split it up, aerobics one day, weight resistance, and then kind of do it that way. But 150 minutes is the minimal level, and anything above that just seems to be more protective. So, key takeaways today. I went through prevention and treatment and survivorship. So the bottom line on what we eat is more plant-based. So trying at every meal to think about, okay, I need some fruits or I need some veggies, or as you're just going through the day, just try to think back on, okay, what did I have for breakfast? What did I have for lunch? And what did I have for dinner? And most of us eat the same thing for breakfast on most days of the week. And so if you could maybe make it a goal of 5 days a week, I'm going to have at least a fruit at breakfast. And it could be orange juice. 4 ounces of orange juice, just natural oranges, nothing in it, counts as a fruit. So that's pretty easy to do. If you're a raisin person, 2 tablespoons of raisins is a fruit serving. So it doesn't have to be, big, huge portion sizes. It can be something really easy peasy. And also, if we have any dessert eaters in here, if you take a piece of fruit and you either put some whipped cream on it or you caramelize it a little bit in the microwave or the oven and break it down a little bit, like pears are really good, peaches, apples, put a little cinnamon on it, put a little tiny bit of brown sugar on it. It's like a dessert, and that's an easy way to get a piece of fruit. Veggies, if you're not a veggie person, then sometimes it just takes being creative. If you like refried beans with a Mexican meal, mash some tomatoes in there, or corn, or coleslaw is a really great, easy way to get a veggie if you're a coleslaw person. And a lot of restaurants now have coleslaw available. Treatment, the biggest thing through treatment is just trying to maintain your weight, getting that protein in, and staying hydrated. And so however you do that is the best way to do that to get you through treatment. And then survivorship is, okay, now if I haven't made any changes in my lifestyle, this is the time period to think about, okay, what's going on with exercise and how do I eat? How do we prepare meals? Things like that. And then obviously professional support can be helpful to just have you talk to somebody else and get maybe ideas. That AICR website that I talked about has tons of recipes on it. And I've made quite a few and they always come out really good. They're usually pretty easy. So it might be a place to just go with and get some ideas, because we all get stuck in the same rut as far as what kind of meals that we tend to prepare. And if you, I always suggest, okay, I don't know about we, but I'm going to use that term loosely. If you have cooked forever, like I have, and I'm sick of cooking, I sit down and make a list. Okay, what are things that we like, and what are things that I know I can easily make? Because I tell this to people all the time. I usually only make things if they can be made in 20 minutes or less for my dinner. My husband's on his own for lunch, and I'm on my own for lunch, so I don't worry about that. But at dinner time, I'm like, okay, this has to be easy peasy. I'm not going to spend, I'm not Julia Child. I do not spend hours preparing my dinners. And I just make myself a list, because a lot of times I forget things. Oh my gosh, we haven't had that in a long time. And I try to do it before I go to the grocery store. And I've been around long enough, and I guess I got this from my mom. I make a list when I go to the grocery store. And I spec out meals for the week so that I have the stuff on hand. And then I have stuff, let's say I'm making something with basil. Well, I was again shocked this week how basil doesn't last very long. So I know I got to use it up right away, right? And just trying to think about making things easy and things that you like. And then if you eat out, just try to think about, okay, balance. I need some protein, I need some veggies, and I can't have the big pile of starch they want to give me. Okay, so I'm kind of out of time, and here's the translation. I know you guys have your handout. This is what the Mediterranean diet looks like if you want to know about how many food servings I should have per day to kind of reflect this. And then there are no superfoods. I'm just going to stop with that. Okay, hopefully that wasn't too fast and furious. So wow. I'm doing online first.
Yes, Mary, oh my gosh. That was so much great information. So a couple of questions that came in. Organic, do we need to go organic? I guess that would be one.
Great question. So I go by the environmental work group recommendations. And so regarding organic, they usually put together a list of the clean 15 and the dirty dozen. Has anybody ever heard about that? Yeah. So it changes not super frequently, but a little bit from year to year. So when you look at the Dirty Dozen, usually I'll try to buy those organically. And typically there's lettuces on there, there's peaches, there's strawberries, things like broccoli, bananas, onions, kale, cabbage. You do not need to buy those things organic. So that's kind of how I parse it out. But keep in mind that I could have my plot of land here where I'm practicing organic and all the plots around me are not, and their stuff is coming over into my area and my soil is being contaminated with their stuff. So it's not foolproof, but it's something to think about.
Okay. How about coconut oil? Bad for you?
I personally I'm not a fan of coconut oil just because, and again, this is an area of controversy in the nutrition field. It's higher in saturated fat. And there's some people that say, well, it's not the bad saturated fat, but other people are like, it's still saturated fat. And we tend to get too much saturated fats in our diet anyways, and it's loaded with saturated fat. So if you were really paying attention to how many grams of saturated fat you were getting, in most women, it's 10 to 15 grams a day, and coconut oil is loaded, then you shot your wad for the whole day. No cheese.
Okay. I have heard that aloe juice is a good, that can be good for your mouth sores. Do you know anything about that? So there is some aloe juice. It's available, I know, at like Trader Joe's. And I actually just saw some at Costco. They had some bottles of aloe juice. And because of the healing properties of aloe, so I didn't know if you had heard about that. I had actually heard from an oncology nurse years ago to try that when you have mouth sores. So I was just curious if you've ever heard of that.
I personally, maybe I have since I've been doing this for 25 years, but it's not on the tip of my file process right now. But you're right, it does have medicinal properties and it's not going to hurt you. So if people bring up things that I don't know anything about, one, I offer to go look, and two, I go, well, if it's not going to hurt you, try it and see. And if you don't mind spending the money on it and you hate it and you have to throw it out, then you can try it. But
yeah, okay. I just didn't know whether that was something that was out there because it seemed like it was sort of something different. Another one is about sugar alternatives. Do they increase your cancer risk?
well, the evidence we have now, it appears no, but they have been affiliated with inflammation per se. And so again, it's kind of like I always say to people, how much are you having per day or per week? Because some people are drinking like a lot of diet soda during the day, like a liter of diet soda, day after day after day. That's a pretty hefty dose. But if you're having something with stevia in it maybe once a week, then I basically don't think that's a huge concern. But I just think we don't, when it comes to like nutrition and cancer, and you have cancer cells and then you have all these nutrients and then you have a lot of vastness in between, it's hard to pinpoint exactly, is there a direct line, direct relationship?
Okay, great. Mary, I want to thank you so much for being here. I'm going to wrap up with our online audience. I'm going to turn it over to you for any questions in person. Thanks for being here today.
Thanks, Maya.
Thank you. Thanks again for joining us. We hope you'll come back next week. We are going to be talking about fragility fractures, what you need to know, on Tuesday, September 23rd at 3 p.m. If you're interested in that class, please give us a call. Our phone number is 520-324-1960. We hope to see you then. Thank you.